Hello, good day to everybody. I am Dr. Pradeep, consultant interventional pulmonologist. Today we are going to discuss about an regular problem or a most common respiratory problem, that is community-acquired pneumonia. Pneumonia, to put it in a simpler words, it is nothing but infection and the resultant inflammation of the lung parenchyma, which results in accumulation of exudative fluid in the air spaces. To put in medical terminology, in the alveoli, that are the air sacs, because of the infection, our body reacts and causes a lot of fluid to cause accumulated in the air spaces. As such, it will be difficult for the air to go into the blood and come out of the blood into the lungs. So when we are speaking about a community-acquired pneumonia, it is basically infective pneumonia. So again, this infection can be either bacterial or viral. The most common bacteria that are causing community-acquired pneumonia are Streptococcus pneumoniae, Haemophilus influenza, Legionella catarrhalis. And there are other bacteria which are called atypical bacteria, which also cause community-acquired pneumonia. The organisms which comes under this atypical bacteria are Chlamydia, Mycoplasma, Legionella. So there are so many risk factors are there. There may be modifiable risk factors, non-modifiable risk factors. The most important non-modifiable risk factor when it comes to pneumonia is age. Either too young, that is below 12 years, or too old, greater than 50 years, those population are more at acquiring a pneumonia or a respiratory infection. Any lung infection, whether it is pneumonia or else, the most common symptoms include cough. This cough, if it is bacterial, mostly it will be associated with expectoration, that is sputum will be present. The sputum color might give a look into the organism causing it. It can be white, yellow, green, rusty sputum, or sometimes blood also may be present. Along with cough, patient may also have fever, which can be high grade, with chills and rigors, chest pain, breathlessness, and any other symptoms which include fall in BP, giddiness, vomitings, vision disturbances. The most common complications are: one is sepsis, second is respiratory failure, and pleural effusion, means there will be a fluid accumulation between lung and chest wall on the side of the pneumonia. Lung abscess, if the sepsis or the infection might spread into the blood, it can also cause to failure of other organs. Chiefly it can cause to kidney injury, that is acute kidney injury, acute hepatitis, or if the blood investigation goes to brain, it can cause septic encephalopathy. In a rare instances, there are brain abscess have also been reported. So diagnosis of pneumonia is basically, again, it comes to clinical inspection followed by various investigations. Clinical inspection, we doctors, we start examining the patient as soon as the patient enters into our cabin or when we see him in ER. So the most common things what we observe are how the patient is having, whether he is having fever, he is having any breathlessness, is he having any other bodily changes like rashes over the body, how is his BP, how is his conscious levels. All these conditions we examine clinically. And coming to other investigations, where lab investigations. Lab investigations, again, there are two types. One is radiological investigations and the other one is blood investigations. Radiological investigations include chest X-ray. Initially it will go for chest X-ray. Sometimes chest X-ray may not give the full picture, but if we doubt that still there is a pneumonia or lung infection is present, then we can go for CT chest. If CT chest or chest X-ray shows there is a pneumonia, it will be decided whether to treat the patient on OP basis or after admission. The admission criteria depends on the type of presentation, whether patient is having high grade fever, whether his vitals like saturation and BP are well maintained, whether patient is having any breathing difficulty. Coming to other blood investigations, the normal blood investigations that we usually use in pneumonia is, one is complete blood picture, wherein we expect a elevated total leukocyte count. Also ESR or CRP, which are acute phase reactants, they might be elevated. If the patient is very sick, then we will go to other cultures such as blood and urine cultures also. And if patient is having cough with expectoration, it is always advisable to go for sputum investigations, which includes sputum culture and sensitivity. If we are suspecting any viral infection, then nasopharyngeal swab for various viral infection, most commonly we will use for COVID and influenza investigations. The pneumonia, usually it is based on the bacteria or virus. So empirically we all start with antibiotics. Again, the treatment criteria is based on whether the patient is being treated on OP basis or admission basis. If he is being treated in outpatient basis, the treatment will be mostly concentrated on oral antibiotics. If patient is admitted, again the admission, whether the patient is admitted in ward or whether he is requiring an ICU admission. In ward or ICU, the treatment is usually given intravenously. There will also be supportive treatment will be given based on the symptoms, like if the patient is having fever, he will be given antipyretic. If he is having breathlessness or any such things, we will be giving nebulizations or bronchodilators. As such, we will be monitoring the patient. One thing is, whenever you have symptoms like cold, cough associated with fever, if it lasts more than 3 days, it is always advisable for you to consult your physician or pulmonologist. Please don't sit back or use any medicines taken from medical shops without any prescription. Also, when you feel that giddiness or BP is dropping or saturation is dropping or breathlessness is increasing, it's always advisable to consult a doctor. It again comes, a lot of things are there. Most common is smoking, pre-existing lung diseases such as asthma, COPD, bronchiectasis, along with use of immunosuppressant medication. It can be corticosteroids or any other such medication. And also poor nutritional status. People who doesn't have proper nutrition will have lower immunity when compared to regular people, and they are more prone to develop pneumonias. Also, any previous history of pneumonia or any history of critical care admission or ICU admission, they are more prone to develop pneumonias. Community-acquired pneumonia is usually seen within 48 hours or at the time of admission into a hospital. If any pneumonia develops after 48 hours of admission into hospital, that will be labeled as hospital-acquired pneumonia. The most common virus is rhinovirus. After that, it is adenovirus, and nowadays it has become a common thing that COVID or SARS-CoV-19 is also causing it, along with other influenza viruses. As I told you, community-acquired pneumonia is mostly caused by bacteria or viruses, whereas there are other types of pneumonias that can be secondary to what is inhalational pneumonias, like when you inhale some toxic fumes, then it can be called inhalational pneumonias. Or when you got exposed to prolonged dust material or any allergic, then we can say hypersensitivity pneumonia. So these are different types. Chemical pneumonitis, when you ingest anything that is in chemical fumes or any liquid, if it has gone, that can be chemical pneumonia. And any gastric content in a conscious patient or unconscious patient or during seizures or intubated patient, when any gastric content that should not enter into lungs, if it has entered into the lung, then it can be called as aspiration pneumonia. These are all the various different types of pneumonias, but we are particularly concentrating on community-acquired pneumonia because at present scenario, at present environment, at present climatic condition, we are facing a lot of community-acquired pneumonia cases in our hospitals. If the patient is being treated in OP basis, then the treatment may last for 7 to 14 days. If the patient is being treated in IP, the IV treatment may last up to 7 to 10 days, followed by, if necessary, oral antibiotics may be initiated after discharge. Again, pneumonia, the disappearance or whatever we say, resolution, there are two types. One is clinical resolution and one is radiological resolution. Clinical resolution of pneumonia may occur around 7 to 10 days if it is severe pneumonia, or if it is regular pneumonia, within 3 to 5 days patient will feel better. But when it comes to radiological resolution, the radiological resolution are the shadows which appear on CT or X-ray. They may take few weeks to months. It may last up to 3 months also. As per the guidelines, any patient or anybody, irrespective of age, if he is having any comorbidities such as diabetes, hypertension, cardiac problem, kidney problem, liver problem, hemoglobin low, that is anemia, or pre-existing lung problems such as asthma, COPD, all these patients, they are required to take vaccines. One vaccine is influenza vaccine, that should be taken every year, and the second vaccine is pneumococcal vaccine, that should be taken every 5 years. The main goal for giving vaccination is, one thing is to prevent pneumonias, and which cannot be done 100%. Even if pneumonia occurs, around 50 to 60% vaccinated individuals, the pneumonia will be less severe when compared to non-vaccinated individuals. Thank you.